So you might have heard this term floating around, Healthy People 2030. Sounds kind of big, right? Little official. But what is it really? And maybe more to the point, why should it matter to you? Well, stick around because we're going to break it all down.
I mean, just imagine this for a second. What if we actually had a roadmap for a healthier nation? A single blueprint that everyone, from your local city council to the big hospital systems, could look at and say, okay, this is the plan. It sounds super ambitious, for sure, but that's exactly the idea behind this whole thing.
All right, so let's get into the specifics. What exactly is Healthy People 2030? Okay, so at its very core, it's a 10-year national plan. And this isn't some brand new idea. The US has actually been setting these goals every decade for over 40 years. But here is the phrase that really changes the game: measurable objectives. That's the secret sauce. It's what keeps us from being just a bunch of wishful thinking. We're talking about specific, data-backed targets so we can actually track our progress and see if we're hitting the mark.
So yeah, try not to picture some dusty government report sitting on a shelf. Instead, think of it more like a practical, hands-on blueprint. It's designed to be a tool, something for anyone who wants to take real action and improve health, whether that's in a tiny town or across an entire state.
All right, a blueprint is great, but how is it actually built? What are the building blocks here? Let's take a look under the hood.
Well, it's not just pulled out of thin air. It's built on a few really solid pillars. First, everything is grounded in scientific data, what the research actually tells us. From there, it sets those clear national objectives we just talked about. But it doesn't just set goals and walk away. It also provides evidence-based resources, strategies that are proven to work. And maybe most importantly, it's built on community input. Because let's be real, what works in one place might not work in another. And all of that work, it's all pointing towards these 5 big overarching goals. You can think of them as the North Star for the entire decade. This isn't just about avoiding disease. It's about helping people thrive. It's about getting rid of unfair health disparities, building healthy communities, and getting leaders on board to make it all a reality.
This all sounds great in theory, but theory only gets us so far. So let's see how this plan actually translates into real-world action and, what it could mean for you.
Because here's the thing, this massive resource isn't just for academics or government folks, it's a public tool. So the big question is, how can you actually use it to make sense of what's happening right where you live? Let's walk through an example. Let's say you're a parent, a teacher, or just a concerned citizen, and you want to understand the issue of youth vaping. The Healthy People website is this giant, accessible database where you can do exactly that.
And this is where it gets really powerful. On the website, you could pull up a chart that looks something like this. You can see the national target or average for youth vaping, and then bam, you can instantly compare that to your own state. Suddenly, you have context. You can see where your community stands and start to identify the biggest challenges.
But remember, it's not just about the numbers. The website also connects you to what you can do next. You can find the specific objectives the nation is aiming for on that topic, read about resources that have worked elsewhere, and find tools to start organizing for change. It's really designed to take you all the way from data to action.
So, there you have it. That's the basic framework for understanding this powerful public health tool. And that's where we turn the focus over to you.
Ultimately, this is the vision that's driving the entire project. Let that sink in for a moment. A society in which all people can achieve their full potential for health and well-being across the lifespan. It's an inspiring, ambitious goal that frames public health not as just the absence of sickness, but as the presence of well-being.
So we'll leave you with this question. Think about your own town, your neighborhood, your community. What's a health challenge that you see? And now that you know this roadmap exists, how might it help you, your neighbors, and your local leaders start working towards a solution?